Hello, I am Dr. Hall with Oral and Maxillofacial Surgeons of Utah. Today we're going to be discussing the use of Exparel for post-operative surgical pain, and hopefully in a way that helps us to either decrease or eliminate opioid use following surgery. Exparel is a liposomal marcaine. A liposome is just a cluster of vacuoles. These vacuoles are made out of lipids. Here's a picture of a liposome with the little tiny small storage vessels known as vacuoles that they have then infused with marcaine. Marcaine is a local anesthetic that has been widely and greatly used since 1957, and it is a very safe medication if used appropriately for local anesthetic. The vacuole or the liposome breaks down slowly following surgery, so you can think of this as a slow release local anesthetic. So it lasts for 2 to 4 days after surgery as it breaks down from the outside to inside and releases this marcaine out into the soft tissues to help decrease the post-operative surgery pain. I say decrease because this is no guarantee to have no pain following surgery. In fact, I guarantee you're going to have pain following surgery, but this is a way that we can decrease that pain to hopefully to the point where we're only needing ibuprofen and Tylenol. Now, ibuprofen and Tylenol in the double-blinded randomized control trials, which is our highest level of evidence in research, shows that we have the best pain relief by ibuprofen, followed by Tylenol. In fact, when you put Tylenol and ibuprofen together, they actually work in tandem to decrease your pain much more significantly than either of them used alone. And so when you use ibuprofen and Tylenol, that's going to take care of your pain way better than any opioid on the market. But opioids are used traditionally as a third modality because we have an opioid receptor in our body to help us also modulate pain signals and responses. The problem with opioids is that our country faces an epidemic of opioid use. There's people dying every day from the overdose of opioids, and unfortunately, a lot of this is postulated to come from post-surgical pain trying to be managed by pharmaceutical opioids that have been pumped into our system, and then people become addicted, and then they turn to harder or more readily available street drugs or forms of opioids. And so any chance that we have to decrease the amount of opioids that we use in our practice is a win-win for everyone, for us as surgeons and for you as patients, for moms and dads for their young ones. It's just a huge win. So that's why our practice is progressive in trying to use Exparel and find other ways to help with postoperative surgical pain. The problem with opioids, beyond the fact that they are very addictive and they can cause problems, they decrease the amount of breaths we take in a minute, and they also decrease the amount of tidal volume in each breath. And a tidal volume is just basically the amount that we breathe in with each breath, or the depth of a breath. And so not only do they decrease our respiratory rate, but they increase or decrease our respiratory volume, and therefore they can lead to the demise or the respiratory arrest of our patients, that then they can become have brain injuries, or they can even lead to the demise of some patients. Unfortunately, there are a myriad of patients that die following routine surgeries across the country in young, healthy patients because they use an opioid in the appropriately prescribed fashion. And therefore, again, another reason why we should look for other ways to control pain following surgery rather than just falling back on our old dogmatic practices of prescribing an opioid. So the other things that we want to talk about with opioids is they not only cause those issues, but they cause constipation, urinary retention. They have allergy and adverse reactions that can occur with them. And so opioids are not just, oh yeah, prescribe an opioid and it's going to be fine. Opioids also don't take away all of your pain, and so that's another issue. And so at our practice, we often prescribe ibuprofen, tell you to take over-the-counter Tylenol. We'll send you home with a emergency backup supply of an opioid sometimes when indicated. And in those cases, we tell you don't fill this unless you absolutely need it. And what we have found in our practice is the people that we have used Exparel on following surgery, the vast majority of them are not filling their opioids. And the people that we don't use Exparel on, unfortunately, they're filling and using opioids. The other thing that we want to discuss today is the fact that Exparel is FDA approved for many, many surgical procedures, including oral and maxillofacial surgery procedures, in patients that are 18 years and older. The issue is that we use Exparel all day, every day on patients that are under 18. It's called an off-label use, and as surgeons, we are absolutely allowed to use medications and surgical techniques in an off-label use. We just have to have this discussion that we're having right now. And so one of the things as Exparel was hitting the market that I noticed when I was in residency is the vast change in patient management following surgeries in patients as young as 8, 10, and 12. So these 8, 10, and 12-year-olds, we would take a hip graft from their hip, we would repair a cleft of their palate or their lip, and traditionally, those patients would be stuck in the hospital for a few days because of post-surgical pain and trying to manage and keep that pain under control. Even opioids weren't working. And so it's hard to tell them, hey, you got to get up and walk and you got to use the bathroom when they're in so much pain that they don't even want to move. And so when we started using this Exparel in residency in these patients for the hip graft sites and their oral and lip and mouth sites, we noticed that these patients are now out of bed, they're going to the bathroom, they're walking around, and it was a night and day stark difference in the fact that now instead of telling patients, hey, please get out of bed, please use the restroom, now we're having to tell them, hey, you can't wrestle, you can't run around, you can't play hard because you can have a hip fracture and you need to maintain your activity at a lesser degree for the next 6 weeks or else you will sustain a hip fracture. And so again, the difference there was that the pain was incredibly decreased and it was much better off with the Exparel. And again, we use it in patients that are much younger than 18 years of age, and we use it judiciously and appropriately in these patients. And we've noticed great outcomes for thousands and thousands of patients and hundreds of thousands of patients across the country that are well below 18. So that's Exparel. Thank you for tuning in.